we have some extraordinary leaders in the digital health ecosystem around the women's health area.
I'm the Chief Medical Officer of Stella or Curio. It's a digital therapeutic company. And I'm just really delighted to be here to be joined by two incredible women, clinicians at heart, but also entrepreneurs in their own right, Dr. Jenny Tang and Dr. Karen Patrowski. I ping it over to them for their insights. I just want to tee this conversations off with some background. This is about mothers in our country, and they're not okay. 1 in 8 women in this country reported having depression or depressive symptoms after giving birth, and yet over half of them are never treated. Many of us, or many of you, are even aware that perinatal mood and anxiety disorders is indeed the most common medical complications during and after childbirth. Even before the COVID pandemic, the rate of postpartum depression has been on the rise for the last 15 years, increasing as much as 5 to 7 folds, depending on which reports you read. Certainly, COVID has created a crisis on crisis, as social isolation and increase in general anxiety within our society about the uncertainty and health risks of COVID. It is estimated by the CDC, for instance, that twice as many women now are reported to have depression, either during or after their pregnancy. So we're in the midst of a large public health crisis in women's health. And yet COVID did accelerate the adoption of technology, and we hear it all throughout today's conference. And thus we see that it opens up the opportunities for a digital health transformation in women's health. We will hear from our clinical experts on, from their perspective, how digital technology can help transform women's health and mental health, especially around the integration of both. So first of all, a little bit introduction of our two experts. Dr. Jenny Tang is a board-certified OBGYN and an assistant professor at Mount Sinai Health System. She provides direct patient care at the system's faculty practice, and which is one of the most, I think, culturally and socio-economically diverse geographic region probably in the country. She's also a principal investigator in multiple clinical research projects in women's health, and has recently launched a postpartum recovery course that will be delivered to over 1,000 clinicians in Asia, primarily China to begin with. Our second expert is Dr. Karen Patrowski. She's also a board-certified OBGYN and has amassed over 30 years of clinical experience. You would never know that when you see her. She looks like she just graduated from medical school. As a clinician who saw the value and promise of technology early on, she founded Verbena, which is a women's health platform offering telemedicine and telehealth services to women across the healthcare spectrum, from adolescent care, reproductive health care, to OB and well person care. So let me introduce to both of them. So first question, I'm going to ask Dr. Jenny Tang. Jenny, how large is this problem of maternal depression? And what do you think are the barriers that women face, especially during the pregnancy and after pregnancy, in getting their mental health care needs met?
Hi, everybody. Thank you, Eliza. Thank you, HitLab, for inviting me to really be an advocate for women in this pandemic, not just COVID, but mental health pandemic. So as Eliza have already alluded to earlier, 1 in 8 women reported depressive symptoms. So there's some surveys recently have been shown 19% of women actually will have some depressive symptoms. And out of those 19%, if you just like separate them demographically wise, because I am in the academic center and our hospital is in a unique zip code where we have a merge of the wealthiest and the poorest in the whole world, as well as the different ethnic backgrounds. And as many as up to 38% of low-income women of color have experienced some forms of clinical depression. And for small percentages, up to 3 to 5%, and those postpartum depression actually will progress to become even so what's more severe called a postpartum psychosis, which includes confusion, hallucinations, and increased risk for suicide and self-harm. As you can see, in the general population, this is a pretty big 20%, that's 1 in 5. And in a subpopulation where women, most of those women are on a Medicaid insurance program where they received care from a government-assisted clinic, which in our hospital, we have a large clinic provide care to those women who are on a government assistance program, about almost 38%. That's like 2 out of 5 women will show some form of depressive symptoms. So this is a large prevalence. And given COVID, and I think the number probably, we don't have any recent number yet, but given COVID in the last 12 to 14 months, I'm sure this number will have gone up. So what are some of the barriers that women face? So I can see the 2 biggest barriers are affordability and accessibility, right? So why women of low income in the demographic area, because they don't have access to healthcare, and they don't have anybody that will help them. So accessibility, affordability, they cannot afford to pay for a mental health professionals to provide care for them. They just don't have the resources. They are probably making their end meet by just putting food on the table and try to get food stamps or buy food and just get some basic like day-to-day living necessities. How can they even find the time, accessibility, and affordability to afford to see someone who's going to discuss about how their mood is, how they feel today, or they have to worry about they probably don't have enough food to eat for the day. So these are the large barriers for women to have access to mental health care professionals. One thing that we've done at Mount Sinai, because of our unique zip code and because our hospital leadership have really provided us with support. So we actually have a really strong social worker programs at our hospital. Social workers penetrate into almost all aspects of prenatal clinics. Every single mom come through the door will have initial visits with the social worker. They will analyze their home situations. They will analyze their relationships with the community, within their families. We also have a faculty practice where I practice mostly. Those are the women coming from more different kind of background. They all have commercial insurances. The social worker don't come through to interview every single one of our patients here. However, we do give our patient a survey, the initial survey called the Edinburgh Depression Survey. So our patient will fill out a survey. And if the score is above certain number, in our case above 9, that would trigger a call, an interview, and either a telehealth interview or face-to-face interview or telephone encounter between our social worker to those prenatal moms when they first come through the door.
Well, that's fantastic. I think one of the areas that you highlighted, right, is the accessibility, and that one of the potential effective and promising modality or clinical model is what's called integrated care, right? Like you've said, with social worker on site. However, unfortunately, not every practices or every systems have resources like Mount Sinai's with the integrated assets in behavioral health. So let me turn to you, Karen. So we hear integrated behavioral health care works. Now, given the fact that you're an early adopter of technology, how do you see technology can help with integrating behavioral health into maternity care, in both whether it's prevention or management of mental health conditions such as postpartum depression?
Yeah, so digital technology, I think, has been one of the big bonuses here. I think that being able to get a bird's eye view as opposed to a snapshot into a woman's life, especially when she's most vulnerable. So maternal health, it's a tremendously vulnerable time. You layer that on top of COVID, and it's really a perfect storm, with stay-at-home orders and physical isolation, emotionally isolated from family, from friends, and even from the health professionals who they're connected with. So I think what the pandemic did, if we can look at a silver lining, what, in addition to lack of access and cost that Jenny spoke about, but I think we've also taken a little bit of the stigma away. I think many who thought they were not who are invincible to any kind of health issues, from anxiety, depression, stress, uh, um, alcohol overuse, addiction. These are all things that I don't think any person or family really escaped over the course of the pandemic. So we've, in some respects, removed some of this stigma. Of course, culturally, it's looked upon differently in different ethnic groups. So we certainly need to be sensitive to that. I think that it's definitely an interdisciplinary approach. So, digital isn't going to be the one solution. We need to take into account family, friends, but we saw just the simple Zoom component kept us connected when we were all so isolated. And the big bonus here was augmenting that into the office space. So when a patient couldn't come for whatever reason, pandemic fears, or because life was hectic, having a digital option was an amazing approach to keep her connected, to try to intervene early so that when you're concerned about a problem, the ability to seek care, notice something, intervention was able to be performed early. So, of course, it was COVID that forced the pivot. But I think that the digital is going to really be a transformative solution with mental and behavioral health, maternal health, both physical and as well as mental health is going to be a big game changer. What I would say is we always looked at tech as being something isolating, right? We sit on our computers and we're not connected. But if we use it properly, my favorite way to say it is that we can convert the isolating high tech into something that really is a high touch visit, where you can really increase the personal connection. And just on another layer, in some respects, it also helped the practitioner, because the practitioner, when the doors were shut, therapists weren't allowed to see their patients face to face, to not leave them stranded. It really let the patient remain connected. It allowed them to foolproof their practice so that they were always able to maintain that sense of connection. So I really think that the digital option really is a highlight in terms of a great option to the impersonal visit, and really can increase the emotional connection.
Yeah, I love the term, right? High tech can be high touch, and that's exactly it. Because we as clinicians can only see the patients, right, once in a regular office visits, but the patient's experience is 24/7. And the other component that you talk about is what's called the authentic or experience. And some of the previous work that we've done in behavioral health, looking at the comparison between how likely are patients actually going to share with the providers their clinical experience in terms of depression, and actually a digital tool compared to a clinician face-to-face asking a patient with a screening tool. Patients actually more likely to report depression using a digital tool, because maybe the stigma has been removed, it kind of protocolized, so that the questions and there's no judgment component to it. So absolutely, I agree with you. So
I
let's
also think they're in the comfort of their own homes, so they feel maybe less threatened. So that increases that authenticity.
absolutely, absolutely.
Yeah.
So Jenny, one of the feedback or questions that we at Curio often been asked by whether it's investors or partners is, we have to make sure that our tools don't overburden the providers because providers are busy and the workflow is really critical. So can you tell us from your perspective, how can, again, tools like Stellar make providers' life easier instead of giving them more work? So can you give the audience some sort of insights as to how, when we are looking at development of a tool in the workflow, what should we look at, or how should we think through that?
Yes. So just like we are telling our patients, like, okay, don't Google it, right? So like you're Googling, Dr. Google is not Dr. Tang, right? You have to come here to talk to me, but Dr. Google is not. But patients do Google, right? Because like you said, we're not there 24/7 for them. So what's the easiest thing for them to do? So I think an app like Stella will provide education for patients, because there will be like a positive reinforcement. Yes, you're doing this. That's going to make you feel better. Or like, they're maybe they're will continuously to collect daily data, information about the patient that the physicians are not going to be able to provide. So in both ways, you're enhancing the communication, you're enhancing the experience from both, the providers actually providing you with educational materials, and the patients giving you additional insight for information that you are not going to be able to get it from a 15-minute session. Let's say the most you can do is maybe like 30 minutes for a first visit. Then usually the patient comes in 10 to 15 minutes. But these are you getting all these insightful information that will be able to help you to come up with a diagnosis. Most of the healthcare insurance companies don't reimburse any type of like just okay, you're anxious, but you need to have some kind of a diagnosis for the insurance company to pay for, to reimburse for the time. So I feel all these digital tools, they provide us to keep us connected with the patient, to provide patient with more educations, and the patient will come back, provide us back with more information that can further help enhance their care.
Thank you. I think you hit it right in the nail, right? Prevention is always the most effective way, whether it's prevention of a condition from realizing, or prevention of someone getting more severe. And yet the current reimbursement system doesn't really directly reimburse for prevention, right? So there's no CPT code for these type of services. Thank you. So maybe we could pivot to on the patient experience component. So Karen, as we all know as physicians, one size doesn't fit all, right, in terms of medical care. So how do we effectively utilize digital technology, to scale and to increase our reach and connectivity to our patients or to the consumers, but at the same time create that unique experience for everyone?
Yeah, so I think more than anything, probably mental health is probably the hardest condition to quantify, because it really can't be measured. It's not measured in a blood test. It waxes and wanes, it fluctuates. And especially as you look at it in terms of maternal mental health, it can impact a whole family. She's got a newborn, children, partner. So the repercussions can be enormous. So it of course, it requires that communal effort, support systems, skill training, outreach, but having the opportunity for a digital mechanism to get that peek into her life, when she's rushed in through the office and feels the stigma of maybe not emotionally feeling well, not feeling happy, even though she thinks she's supposed to, she's going to potentially put on a facade. So if over time you can really get into her home and look her in the eye if she wants to or not, you may get a much more accurate assessment of what's really going on. So that is how I think a digital component can really be transformative for behavioral health broadly and specifically for maternal mental health and mental health in particular.
Oh, thank you. I think we just got to signal that maybe our time's up, and you know, all three of us can probably sit and talk forever and ever. So, well, once again, we want to thank HIT Lab for the opportunity to share our views and to advocate for women's and mental health care.